Hello everyone, magandang araw sa inyong lahat. My name is Randall Lulu, or you could call me Randall from Pedro, Calungsod. And for today's video, nakita naman sa ating title na ating pag-uusapan ngayon ay may kinalaman sa aking love life.
Oh my God! Wow!
Joke, study first. Kidding aside, for today's video, I'm going to discuss the topic that I chose, which is the ankle sprain. And I will give you also some additional information about it. But before I start, let me first introduce to you what is injury. Or I will discuss to you what is injury. What is a sport injury? Sports injuries are injuries that occur when engaging in sports or exercise. This event can occur due to overtraining, lack of conditioning, and improper form or technique. Sports injuries are commonly caused by overuse, direct impact, or the application of force that is greater than the body part can structurally withstand. Failing to warm up increases the risk of sports injuries. Bruises, strains, sprains, tears, and broken bones can result from sports injuries. A sports injury has two types as well, namely acute injury and chronic injury. Pero, ano nga bang pinagkaiba ng dalawa? Two types of sports injuries. Acute. It is sudden or unexpected. An injury that occurs suddenly, such as a sprained ankle, caused by an awkward landing, is known as an acute injury. On the other hand, chronic, it is overuse injuries. Chronic injuries are caused by repeated overuse of muscle, groups, or joints. Poor technique and structural abnormalities can also contribute to the development of chronic injuries. And now, here are some examples of sports injuries. Strains, sprains, knee injuries, concussion, swollen muscles, Achilles tendon injuries, pain along the shin bones, rotator cuff injuries, fractures, and dislocations. Now, that we've all gained knowledge and understanding about sports injuries, it is the time to present and discuss to all of you the topic about ankle sprain. So first, ano nga ba ito? Or should I say, what is the meaning of it? A ankle sprain is an injury that occurs when you roll, twist, or turn your ankle in an awkward way. This can stretch or tear the tough bands of tissue that help hold your ankle bones together. Ligaments help stabilize joints, preventing excessive movement. A sprained ankle occurs when the ligaments are forced beyond their normal range of motion. Most sprained ankles involve injuries to the ligaments on the outer side of the ankle. A person who is experiencing a sprained ankle might have these signs and symptoms, vary depending on the severity of the injury. These may include pain, especially when you bear weight on an affected foot, tenderness when you touch the ankle, swelling, bruising, restricted range of motion, instability in the ankle, popping sensation or sound at the time of injury. Of course, sprained ankle will not happen without any reasons, right? So in this part, I will show you some might reasons, on how injury called ankle sprain develop. An ankle sprain occurs when the foot twists or rolls unexpectedly, causing the ankle joint to move out of its normal position. As a result of rapid or unexpected movement during physical exercise, the ankle may twist inward. One or more ligaments around the ankle stretch or tear as a result of this. For further explanation about this matter, I will show you some video clips wherein ankle sprain would possibly develop. First, bad landing. Second, wearing the wrong type of shoes for your sport. This puts you at risk of twisting your ankle or even falling. Third, placing unusual stress to the ligament. This could be from walking or running on an uneven surface, jamming your foot, or twisting your ankle in an odd way. At this point, I want you guys to remember these ways on how to treat sprained ankle in a good way. So first, when treating a sprained ankle, whether from athletic training or a sports injury, be sure to follow RICE. Hep hep hep, hindi ito bigas o kanin. The letter R of the word RICE stands for rest. I for ice, C for compression, and E for elevation. We could also treat sprained ankle by taking non-steroidal anti-inflammatory drugs or NSAIDs. This can alleviate pain and swelling. 2. Strengthening, stretching, and balancing exercises. Work with a physical therapist or your coach to improve the sprained ankle. And lastly, make an appointment for ankle sprain treatment and care. Additional information to avoid such injuries. First, you must know the rules of the game. Second, wear protective gear like helmets, protective pads, and etc. Warm up and cool down is necessary. Watch out for others to avoid hitting or worse, an accident. And lastly, don't play when you're injured. Based on my observation, I could say that everything we do, regardless if it is big or small, has an impact to us. But there are also events in our life that it is not unexpected. Just like having a sprained ankle, right? So, I want you guys to remember that before we do such a thing, we should always think and consider a lot to avoid accident. And if accident happened, you should trust God, be resilient, and have a positive mindset because just like what I've said a while back, everything happens for a reason, and everything that was happened will go to an end soon. Again, I'm Randall Lulu from Pedro, saying good day and have a great week ahead, everyone. Bye!